Diabetes. Diabetes is a chronic condition characterized by high levels of sugar glucose in the blood. It occurs when the body either does not produce enough insulin, a hormone that regulates blood sugar, or is unable to use insulin effectively. There are three main types of diabetes. Type 1 diabetes. This occurs when the body's immune system mistakenly attacks and destroys the cells in the pancreas that produce insulin. Type 1 diabetes is usually diagnosed in children and young adults and requires lifelong insulin therapy. Type 2 diabetes. This occurs when the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. Type 2 diabetes is more common in adults and is often linked to lifestyle factors such as obesity, lack of exercise, and poor diet. Gestational diabetes. This type of diabetes occurs during pregnancy and usually goes away after the baby is born. However, women who have had gestational diabetes are at increased risk of developing type 2 diabetes later in life. Symptoms of diabetes can include increased thirst, frequent urination, fatigue, blurred vision, slow healing sores, and tingling or numbness in the hands or feet. If left untreated, diabetes can lead to serious complications such as heart disease, kidney damage, nerve damage, and blindness. Treatment for diabetes typically includes a combination of lifestyle changes such as diet and exercise and medications such as insulin or oral diabetes drugs. Managing diabetes requires ongoing monitoring of blood sugar levels, regular medical checkups, and careful management of other health conditions. What causes diabetes? The exact cause of diabetes is not yet fully understood, but both genetic and environmental factors are believed to play a role. Type 1 diabetes occurs when the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. The exact trigger for this autoimmune response is not known, but it is thought to involve a combination of genetic and environmental factors, such as certain viruses or toxins. Type 2 diabetes, on the other hand, is often linked to lifestyle factors such as obesity, lack of exercise, and poor diet. When the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels, it can lead to type 2 diabetes. Genetics can also play a role in the development of type 2 diabetes, but lifestyle factors are generally more important. Gestational diabetes is believed to be caused by hormonal changes during pregnancy that can affect insulin sensitivity. Women who are overweight, older, or have a family history of diabetes are at increased risk of developing gestational diabetes. In summary, while the exact causes of diabetes may vary depending on the type, genetics and lifestyle factors such as obesity, lack of exercise, and poor diet are believed to play a significant role in the development of the disease. Symptoms: diabetes. The symptoms of diabetes can vary depending on the type of diabetes and the severity of the condition. Some common symptoms include increased thirst and frequent urination, extreme hunger, even after eating, fatigue and weakness, blurred vision, slow healing cuts or sores, tingling or numbness in the hands or feet, unexplained weight loss, irritability and mood changes. In type 1 diabetes, symptoms often develop quickly and can be severe, while in type 2 diabetes, symptoms may develop slowly over time and may not be as noticeable. Some people with type 2 diabetes may have no symptoms at all. In gestational diabetes, there may be no symptoms, or symptoms may be similar to those of type 2 diabetes. However, gestational diabetes is usually diagnosed through routine prenatal screening. It's important to note that not everyone with diabetes will experience symptoms, and some people may have symptoms that are mild or easily overlooked. If you suspect that you may have diabetes, it's important to see a healthcare provider for a proper diagnosis and treatment. Treatment of diabetes. The treatment of diabetes depends on the type of diabetes and the severity of the condition. The primary goals of treatment are to control blood sugar levels, prevent or manage complications, and improve quality of life. Type 1 diabetes. People with type 1 diabetes require insulin therapy to control their blood sugar levels. Insulin can be delivered through injections or an insulin pump, and the dosage may need to be adjusted regularly based on blood sugar levels and other factors. Type 2 diabetes. Treatment for type 2 diabetes may involve lifestyle changes such as weight loss, a healthy diet, and regular exercise. In addition, medication may be prescribed to help lower blood sugar levels. Some people with type 2 diabetes may also require insulin therapy. Gestational diabetes. Treatment for gestational diabetes typically involves dietary changes and monitoring blood sugar levels. In some cases, medication may also be necessary. In addition to medical treatment, it's important for people with diabetes to take an active role in managing their condition. This may include monitoring blood sugar levels regularly, following a healthy diet, exercising regularly, and managing other health conditions that may be related to diabetes, such as high blood pressure or high cholesterol. Complications of diabetes can include nerve damage, kidney damage, vision problems, cardiovascular disease, and more. Managing diabetes effectively can help reduce the risk of these complications. It's important to work closely with a healthcare provider to develop an individualized treatment plan that is tailored to your specific needs and lifestyle.